Hi, I'm Elizabeth. I work as the long-term conditions lead for Swindon Talking Therapies. I originally trained as a clinical psychologist, and my particular interest is in the crossover between our physical and mental well-being. So, what is a long-term health condition? This is any condition which we have to manage in the long term rather than have treatments in the short term. 4 in 10 of us live with at least one long-term health condition. And some of the more common conditions that we see include things like diabetes, lung conditions, heart conditions, chronic pain and fatigue, and long COVID. And we also see people who have persistent physical symptoms for which no diagnosis has been given. 2/3 of people living with a long-term health condition experience an impact on their mental well-being. Living with a long-term condition can be hard, both practically and emotionally, and that it can just have such a wide-reaching impact on our lives. We might have to make changes like new medications or lifestyle habits. We might not be able to do the things that we used to do, like our hobbies or other things that matter deeply to us. Or we might have to do those things differently. We might have to manage new or scary symptoms, or we might have worries about what will happen in the future. And all of this can at times be really overwhelming. It can be common to feel low, anxious, frustrated, or stressed at times. Our long term conditions pathway helps people where their long term condition is impacting how they feel, or where their mental health is making it harder to manage the condition. This is often based on cognitive behavioural therapy or CBT, where we learn to understand how our thoughts, feelings, and actions can keep us trapped in vicious cycles. For example, it's common for people to push themselves harder on their good days to try and make up for the bad days, but often that leads to a crash and another flare up, and we can get stuck in a cycle of boom and bust. And over time, that cycle can even mean that we can do less overall. Or we might feel anxious about our symptoms. Maybe we've got breathlessness or strange pains in our body. Anxiety can mimic or worsen these symptoms, and we may find that we start to avoid doing things so we don't feel so anxious. This means that we feel better in the short term because we feel less anxious, but in the long run, both our symptoms and our anxiety can get worse. So, CBT is all about understanding and changing these cycles so that we can live a life that helps us to feel happier and more fulfilled. We have some specialist options for people living with long-term conditions, including adapted online programs, group courses, and practitioners with extra training in this area. I see some clients myself, but my role is also to support staff to support our clients with health conditions. That might include training, supervision, where we talk through cases together, or creating tailored resources to use in therapy. Historically, the NHS has been quite separated into physical and mental health services. So part of my role is to try and help us to work in a more joined up way across NHS teams that someone might be accessing together. We join up with physical healthcare teams to co-facilitate courses together, and we try to make it easier for people to be referred in between our services. The overall aim is to give people living with long-term health conditions a better experience of holistic healthcare for both their physical and mental health.